Thursday night. I'm Dr. Nick Circolone with Health Chat. I have to say I am super excited. We have not been on the air in over 2 years since COVID started. We've been doing Facebook and we've been doing YouTube Live. So if you guys have not heard of me or have no idea who I am, you're in for kind of some craziness. I don't know if they're ready for this, Joe. I don't know if they're ready for Crazy Town, because that's how it's going to be.
They've had it good recently, so yeah, it's going to be different. It's going to be real different.
Quiet. No, I don't think we're going to be quiet at all. Well, again, I'm Dr. Nick Circolone. I am a chiropractic orthopedist. I am actually the only certified chiropractic orthopedist in the Chattanooga area. That means everybody's going, okay, what's a chiropractic orthopedist? I'm actually, I have a fellowship. I actually went to school for another 3.5 years following my chiropractic school to get my degree, and I ended up passing a national board exam to be able to be called a chiropractic orthopedist. What does that mean? Basically what that is I'm a non-surgical orthopedist. So if you have orthopedic issues that are not surgical related, we can see them and we can look at them. Now, let me say this. It's a caveat. Everybody goes, hey, he's a chiropractic orthopedist, so what? Can I go to see him for this, that, or the other thing? The answer to that question is yes, but a lot of times, if I cannot deal with the problem, I will make sure that you get to the place that you need to be. So I am a full believer in multidisciplinary practice. I believe in seeing other physicians. I believe in physical therapy. I believe in massage therapy. All of these things work together to help our patients get the best possible care out of anywhere in the area. Because I'll tell you what, I had a good example of that today. I had a patient come in today. They had a hip issue. They come into the office and they're like, Doc, what do you think this is? Do you think I need surgery? And I'm like, no, it's a muscle issue. So basically what we did was we looked at it, we examined it, and we said, you know what, let's do some exercising. Let's get some stuff done here that we can do and see if it works and helps within a short period of time. If it doesn't respond within 1 or 2 visits, then we're going to go do something else. I don't do x-rays in my office. People will say, did you do x-rays in yours? No, we do not do x-rays in our office. What we do is we actually send them out to a imaging center, such as Prime Imaging, and we get these beautiful x-rays. We get beautiful MRIs, beautiful CAT scans that we can look at. And I actually talk to those doctors, and we talk about how we're going to go forward with this. Are we going to do injections to that area? Sometimes we have to, sometimes we don't. But a lot of times we're doing things non-surgical, and my job is to keep you out of surgery if we can. So if you've ever been to a chiropractor before and mention that to your doctor, sometimes they'll roll their eyes, sometimes they don't. If you mention my name, I've been practicing now for over 30 years, and most of the guys know me in town. And I hope there's people out there that are listening and going, oh, I remember Dr. Nick when he was on with Julie. And by the way, I have to send that out. I miss Julie. I wish I tried to get Julie. Julie's like, I'm just relaxing. I'm taking it easy. I don't have much to do. I'm just being myself, but, so her not being here is kind of sad, because I had so much fun doing it with her. So if you're listening, Julie, I miss you.
Well, you're good. You're good by yourself too. You can do it.
Oh, I can swing. And I got Joe. I got Cowboy Joe with me. He's gonna kind of chime in every once in a while. And
see, I'm getting older, so I'm gonna have plenty of questions that you can help me with.
Old? How old are you now, Joe?
45.
Holy snap, man. I remember when you were just a little guy working behind the board and then became Cowboy Joe.
Yeah, making zero money and just trying to trade for everything I was getting, yeah.
Well, it's funny. I have a big birthday coming up.
What is it?
60.
The big dog.
The big 60.
You look great. You look great for 60.
I feel good.
Yeah.
My whole thing is, my goal is I want to be 80 years old still doing one-handed push-ups. That's what I want to do. 80 years old.
If anyone can do it, you can do it.
And I'm still able to do them. So, it's kind of interesting. And, we're on Facebook Live right now, which is something brand spanking new to me. I usually do Facebook and shoot it over to Facebook, but I don't necessarily do it as a quick live that I'm doing now. It does come up live, but it's not like it is now. So if we make mistakes, there's no cut button. And also, we're getting excited about it because we're going to start doing Facebook Live. We're going to start streaming to YouTube. We're going to stream to Instagram. If you want to find my channel, all you have to do is click in there on YouTube, Instagram, or Facebook, Dr. Circolone, DrCircolone, and boom, I'll come up, and you'll be able to view my YouTube channel. You'll be able to see our Facebook page. I am more of a YouTuber than I am a Facebooker because, Joe, let me tell you something. I got a really hard time with people's problems. I really don't want to hear them.
You got your own set that you got to deal with,
You know
right?
what? I do. I don't care that your dog needs, like, his nails taken care of. I don't care. And by the way, they don't know, but, like, they're probably out there, everybody's listening going, the dude he talks funny. And I do talk funny. I'm originally from New York, the city. I'm not from the country. I'm from the city. You know, where most Italians are made is in Brooklyn. And that's where I was born and raised. And we moved to Queens and then to Philadelphia. And then, believe it or not, I'm from Philadelphia. I shoot to the Midwest. I'm a Palmer graduate. So I went to Palmer College of Chiropractic in the Midwest. It was like, I felt it was crazy. But when I first came to Chattanooga, I thought I walked into my cousin Vinny. No joke. No joke. I'm like, yeah, I blend. No, I didn't blend. I didn't blend at all. Funny story, Joe. When I first came to Chattanooga, I'm a typical Guido. If you know what a Guido is, it's just like one of those guys. I'm like, hey, how you doing? So I get in my car and I'm driving a red Acura Integra. So it tells you how long it's been since I've been here. So I'm driving down and I'm going down in St. Elmo and I make a right-hand turn and I end up in Alabama. How I ended up in Alabama, I'll never know. So I get out of my car and I go into this little convenience store because I want to get something to drink. Now, you got to picture this. I'm wearing sunglasses. I got a leather jacket on. I got not like one of the leather jackets from like what would they call the Outsiders, but just a regular jacket. T-shirt, my jeans, and I'm getting out of the car. And I go into this store and there's like nothing on the shelf. Like, how are they staying in business? There's nothing on the shelf. So I go and I get a drink and I put it on the table and the woman goes, oh, that'll be 50 cents. And I give her the 50 cents and I walk out. And no joke, there are two guys circling my little car. All right. One with a John Deere hat, one with a cat hat on, a bigger guy with overalls, and the other guy's just like, hey, how you doing? And I'm like, okay, what? And one guy says, that's a foreign car, isn't it? And I said, yeah. And the other guy's going, yeah, that's I bet you it's fast. And I'm thinking, not fast enough because I'm not in it. And I'm looking around and I'm looking for the cameras. I'm being punked. I'm on, Candy
America's
camera.
Funniest Home Videos.
This is something. This can't be real, So the guy says to me, he goes, that can fit in my truck. I was like, I gotta go.
Well, let's not try it today. How about that?
I gotta go. So that was one of my experiences when I first came down here. But I will tell you this. I love Chattanooga. I love the people here. I love raising my family here. I have my wife, my daughter, my son-in-law, my two grandkids are here. So it's a lot of fun. And let me tell you something. If my grandson Nicholas could be here, he would be on the show with us. He would be like kind of hanging out and going, "Hey, can I hang out with you guys?" And he'd be put the headsets on and he would be hanging out. So enough about that. So what are we going to be talking about as time goes on, which is going to be fun? So we're going to take a really quick break. We'll be back. You're listening to Talk Radio 102.3. I'm Dr. Nick Circolone with Health Chat, and we'll be back. All right, we're back. I'm Dr. Nick Circolone. You're listening to Health Chat. We are running Facebook Live at this point. If you are listening, give us a call here at
267-1023.
The Tuck Monster. Oh my gosh. And if you're online, we are still having some issues on Facebook. So if I'm still learning that, I'm not a Facebook, like I said. So if you're on Facebook, give us a call here. There's a 1-800 number too, isn't there?
No, just 267-1023.
Okay. So, and we're going to start getting it where I can see some of the comments that you're making, and I'll answer some of your questions. But today, we're only going to be taking some phone calls. If you have any questions related to musculoskeletal conditions, if you have a question chiropractically, I'll talk about it. If you have a question orthopedically, we'll talk about it. Medically as well. We're actually, my office we're advancing some things right now, which I'm getting super excited about. We're going to be doing nutritional counseling in the office, not your average nutritional counseling. Unfortunately, at this point, insurance doesn't pay for the good stuff. They just don't do it. They don't. Deductibles are high. People are. You're paying an exorbitant amount of money for your insurance, and you're not getting what you normally used to get. We can thank the Affordable Care Act to that. I mean, it does. Don't get me wrong. It's helped some people, but, there are some people that it has not and kind of affected them in a negative way. Unfortunately, we're seeing that as doctors. If you go to your doctor and you've gotten your EOB, your explanation of benefits, and you go, how's he keeping the lights on? He's charging $300 and something and he gets $75. He's doing the work, but we just don't get paid because we're now in network with some of the places. So the Spirit Medical is my other corporation that we have, or other company, and we're going to be doing nutritional counseling out of there. We're also going to be doing some coaching out of there for athletes. And one of the things that we'll talk about, especially in this area, we have a large young athletic community, and I'm seeing a lot of injuries that normally wouldn't be seen by younger people. So what we're trying to do now is we're trying to educate everybody and give them the opportunity to find out how they can prevent injuries, because there's a way to prevent it. Now, I will tell you this, Joe, you worked out and played sports in school, didn't you?
Yes, sir.
Yeah, so did I. I wrestled. We did this great thing, for your neck, and I did a neck bridge. Seriously, we're doing neck bridges. And now my neck is trashed because of that. Thank God I know chiropractors that can help me out with that. But I'm seeing really with some of the young people injuries that they're sustaining that is actually, if they continue on, will cause more problems. And we'll go into that, in a few shows later. We'll talk about treatment that we can do for that. And what I really want to do is I want to get people to understand what we're going to be talking about is mind, body, and soul. Really, because it's one thing. We'll be talking about some things that deal with psychiatry. We'll deal with things with religion. We'll talk about, of course, other medical conditions. I really believe that we are a whole being, and everything has to work in synergy, because if it doesn't work, we end up getting sick. If you're miserable, and I'm a happy guy, is my life going the way it's supposed to be going? Sometimes it is, sometimes it's not. Do I feel like I want to be in a different position sometimes? Possibly. But you got to keep that positive attitude. And if you don't keep that positive attitude, you're going to get sick. And I've seen a lot of people come into the office that are miserable, and some of them are miserable because they're just miserable, and others because they're dealing with a lot of things in life. And I'll tell you what, if you've been around people with COVID and have lost loved ones from COVID, this is no joke. I mean, I'm telling you, this is no joke, and people are getting depressed. They've been staying home. They're not doing some of the things that they would want to do because they're afraid of getting sick. As a matter of fact, I just talked to my wife. She's up in West Virginia seeing her dad. I was up there last week. She got COVID. She just tested positive for COVID today. She doesn't feel sick. She doesn't have any issues, but she tested positive for COVID. Her sister did, and one of the kids did, and I'm thinking I won't be seeing her for another week. So it's the truth. I'm like, yeah, I'm not going up there, baby. I love you, but I'm not going. Did you? I'm going to ask the question, Joe. Did you get COVID?
No.
Yeah, you didn't get COVID?
No.
I got COVID in January. My wife got COVID in January. We tested negative 5 times, and we I had a little sniffle and a little cough, and that was about it. And we were extremely fortunate, when we got it. I went through the whole COVID without getting sick up until this year. I mean, and I was seeing patients. We never stopped one time seeing patients.
Well, it seemed like everyone around me, was tested positive for COVID except me. I guess I was just one of the lucky ones.
Yeah, and I'm almost embarrassed to say I had COVID because it was nothing. It was literally nothing. I had a couple sniffles, and that was it.
I think one of the most crazy things about it is the fact how it affected everyone so differently.
Yeah, and we'll talk about some of that here too, because there's things that you need to be doing, because if you're not doing those things, you're opening yourself for sickness. Not only are you opening yourself up for sickness with COVID, but other sicknesses as well. Now, I personally don't. I take all my vitamins. I do all the stuff that I was supposed to, and I've been doing that for years, and I think that has helped. What we're doing, and COVID's still here. It's not going away. It's still here. You still got to be careful. You still got to wash your hands. You got to watch when you're sitting in crowds. First off, I don't like being in a crowd. I don't care if I could talk to 1 million people as long as I'm not in that crowd with 1 million people. As long as I'm not in that crowd, being from New York, let me tell you something. If you've ever been to New York and you're on the subway, you become intimately connected to people because you're that close.
There's no getting around.
There's no getting
not touching people, right?
When COVID first started, MIT students came up with a scenario of why New York was so bad with COVID. And they go, it's the subway system. Really? Are you kidding me? Like, I didn't know that?
Seems pretty simple.
I didn't know. So literally, you're sitting there, and they're like 2 inches from your face, coughing and everything else. And you're like, oh, my gosh, you're killing me over here. So that to be said, it's not a joke. People really, really did get sick. People have lost loved ones for it. I mean, I know people that have passed away and have lost loved ones. And that, like I said, this is no joke. We can't play with this. People have to be careful. Whether you're vaccinated, whether you're not vaccinated, that's not an issue. The issue is that we have to stay safe. We have to make sure that we're, being smart about things. But you know what? The biggest thing, Joe, is live your life.
Live your life. Yeah.
Live your life. Yeah. You want to hug somebody. That was the worst thing, Joe. And I'll tell you this. In my office, we are very intimate with our patients. We love our patients. They're like family to us. They really are. And if you've been a patient of mine and you're listening, you can call in and like go, yeah, Dr. Circolone is that way. We just really treat people really well. And Shay, my office coordinator, oh my gosh, she's phenomenal. She is like, I used to have work wives. I got work daughters now. They're all young. And I'll tell you what, she is aces. I couldn't do it without her. I really couldn't. Out of all the people that have ever worked for me, I know that I trust this woman the most. So if you ever call the office, it's 855-7376. Shay will literally take care of everything and make you feel totally comfortable. One of the biggest things I see with chiropractic is a lot of people are afraid to go because they don't know what to expect. It's like, oh, I don't know. Is this going to be good for me? Is this going to hurt? If you've been watching YouTube videos on chiropractors adjusting, I got something for you. Stop doing it.
I have seen them. I know where you're going with it.
Stop doing it. Stop looking. Because all that is just fanfare, and they're trying to get the loudest crack that I can possibly get.
Yep.
Can you do the ring dinger? Can you do the Y strap? Can you hang me upside down and beat me like a piñata? No, I'm not doing it.
Come on, man.
I'm not doing it. Forget it. We're not doing it. So, and I get people in there like, I don't like to be adjusted. I'm like, why are you in here? It's like, and then you go, what do you mean you don't like to be adjusted? I don't like to hear the crack. Okay, we can do other things. There's a ton of things that we can do to stop people from getting, that cracking sound. But if you've seen the videos, I go watch some of those videos and go, Dr. Circolone doesn't do that. That's not what he does. And I did a YouTube video recently on why MDs don't refer to chiropractors. And we'll get into some of that a little bit later. I know we're probably coming up on another break in another 5 minutes or so. But there's reasons for it. And one of the things is we don't do any of that. So if you've thought about dealing with a musculoskeletal problem, you had no idea how to deal with it. I'll give you a good example real quick before we take a break. Come into the office and you have low back pain. Well, some of your low back pain may need advanced testing and it may need advanced therapies. Well, if you call your orthopedist up, the local orthopedist, these guys are slammed. They're good. They're slammed. You call our office, you get them into the office, we'll check you out, we'll do our exams, we'll order all the x-rays, the MRIs, whatever we need to do to get to the root of your problem. Plus, we'll do some therapies and treatment on it to make you feel better. And if we don't get better and we need to go and see the orthopedist, the pain management guys, any of those guys, what we can do is we send you there. And by the time you get there, all the stuff is done and taken care of. They don't have to. They love that when they come into the office, or when you bring your stuff into the office. They say, "Oh, you saw Dr. Circolone. I know what I got to do now." So there's a difference. You can get into my office a lot quicker than you can in some of the other offices. We're not saying that we're taking over for these guys. We're not doing that. We're not replacing them. We're working with them, because if we don't work with these guys, then you don't get the best possible care that you can get. And that's one of the things that we want to do. We are all about excellent care. Whether it be chiropractic, whether it be, physical therapy modalities, whether it be massage therapy, whether it be, nutritional counseling, we want to be the best. And that's where we're going with all of this. We got a caller on the line?
Yeah, let's take Wayne.
Okay, Wayne. How's it going, brother?
Oh, now I'm on. You're going to get me on?
Of course you're on.
Do this.
You are.
That was surprising.
Why's that?
Oh, I thought you wanted on, Wayne.
Yeah.
Well, I did. I wasn't expecting it that quick.
You know what? We're just sitting here hanging out, Wayne. We're just chilling and grilling over here.
I know. It sounds like I love it, man.
Well, thank you. I appreciate that. I have way too much fun doing this. Can you tell?
Oh, yeah. I definitely can tell. I wish I could do it.
You know what? There's nothing you can't do. So what can I do for you tonight?
Oh, man, now I messed up because I really don't have an answer. I was just listening to this. Yeah, I screwed up.
No, you didn't screw up. You did good. Sometimes that happens. We're going to take a quick break. We're going to be back. You're listening to Talk Radio 102.3. I'm Dr. Nick Circolone. You're listening to Health Chat.
Would it be true? And I feel it in my heartbeat. Oh, you can put out these flames. You can't keep me down in my seat. I got fire under my feet.
I'll tell you what, I'm getting excited. I love the music. I want to ooh. I was driving in the car listening to some of this, getting all pumped up for this. I want to apologize to the guys on Facebook and the ladies on Facebook. For some reason, it's coming up sideways, and I didn't mean it to do that. We're in the horizontal mode here, but it's not coming up. So if you want to give us a call here, give us a call here at 267-1023. That's 423-267-102.3. The Talk Monster. I'm Dr. Nick Circolone. You're listening to Health Chat. We're back, Joe. We're back. And it's in my blood. I can't help it. I was a little leery about doing this. Because
why?
I don't know. I don't know. It's one of those things where, am I wasting my time? Am I going to be doing something else? But this is way too much fun. I mean,
well, this is part of you're talking about religion, your spiritual well-being, your mental well-being, your physical well-being. I think this is this is your portion of that. So you got to take advantage.
It is. And the problem with it is doing talk radio is I don't like to talk. Actually, my wife goes, "Do you shut up?" She'll come to work with me. I have to say this. We start really early in the morning. I start at 6:30 on Thursdays. And we run two offices. I have one office in Sale Creek. So if you want to see me in Sale Creek, just one number, 855-7376. Just call us there. And the lovely ladies in the office, Kelly and Shay, will take care of you. We have a small office staff. We try to do everything lean and mean, so that way we don't treat people like a number. And that's one of the best things about us. I don't like going in and, we don't see 8,000 people and adjust them the same exact way. Treatment is not the same for every patient. We have, closed exam rooms. We have 3,000 square feet of office space, Joe.
Wow.
Yeah, I mean 3,000 square. We're looking. I'm going to put this out there. We're actually looking for other doctors to come in with us. We're looking for not chiropractors. We're looking for medical doctors, because before COVID hit, we were doing regenerative medicine as well, and I believe in that. I mean, I heard a commercial about it. We do things a little differently. Like I said, we have that multidisciplinary approach, which a lot of places don't have, which is, I think that's where we are.
So you can hit a lot of things at once.
Yeah, and I want that in the office in one place, because I really do see that eventually coming around. And we looked into different things. I'd like to do some mental health in the office. I know that sounds crazy. What does that have to do with me? But you'd be surprised. I'd like to see OT in there as well, and speech therapy. And let me tell you something. We're getting certified. I'm always going to school. I got to go to school for something, right? We're getting certified in, it's called primitive reflex, or delayed primitive reflex, that you see in a lot of kids. And what we're finding is that with these primitive reflexes, if they're not firing, if they're not functioning the way they are, these kids will have some problems. Sometimes it's related to ADHD and autism and things like that, where they really don't have it. It's something else. And we're going to be evaluating the kids and doing treatment. OTs do it, PTs do it, DCs do it. So I'm going to be doing that in my office. So we're trying to open up the door to get more people getting help where they need to get the help. And I really believe that that's where my heart is.
Sure.
It's funny. We were talking about this the other day. I believe that God is going to expand. And before I even start, I'm going to be talking about God a lot, because this is where I am. This is my wheelhouse. This is my space. But I believe that God is going to increase and enlarge our territory to the point where we're able to help support ministry. And that is just charges me up to be able to do that, not only to be able to treat patients, but to actually be able to benefit God's kingdom, which is really, really important. And I'll tell you what, we'll just keep talking about that as we go. Jack, how we doing today, Jack?
I'm doing good.
What can I do for you tonight?
Well, I'll just say that I remember when you were on the air a few years back. I always enjoyed your programs. What you've said about your office and your staff, it's excellent. I encourage anyone to, come by and have you check them out. But what I'm calling about now is that I've been having a problem when I go to bed. I lay there, my leg, particularly one leg, starts kind of giving me a problem with some kind of like shooting pains. It's not really so much a pain as an irritation, but then I've noticed it's gotten kind of worse in that it's repetitive. It'll be like almost like my leg is jerking.
Okay.
But in addition to that, I do have a lot of lower back pain, which gyrates towards my hip. And I don't know if it's muscular. I don't know if it's, a true injury that I've had. And it's just now kind of rearing its head. But the combination of the interruption of sleep and the, tingling of the leg and then the lower back pain, which is pretty consistent. I mean, I can take medicine over the counter and deal with it, but then sometimes it'll come and go, and some days I can't hardly, do anything.
Jack, the low back is such a complex structure. I mean, when we look at it, you have the bones, of course, you have the joints, and the facets are the ones that we see a lot of, but we also have the discs. A lot of times patients, the older we are, it's not so much a disc as it is a facet, an arthritis in that joint or an arthropathy. And what happens is we create this inflammation that's in there. Now, as you're going through the day, you probably don't feel as bad, but when you go to lay down and that swelling or irritation starts affecting that nerve, but it not only affects that nerve, it also affects an artery, a vein, adipose or fat tissue, lymphatic system. So there's a lot of stuff that's going on in that area that can cause that type of leg pain that you're experiencing. If it's not a restless leg type syndrome, because some people have a restless leg, and that's something totally different that has to be dealt with totally different. Chiropractic sometimes helps that, but it may not in your case. But if it is a true structural problem, whether it be in the facet joints or the structures that surround that nerve, it could be something that can be easily fixed with some manipulative therapy, some exercising at home, and really some good nutritional support to that. Because let me tell you, when I say nutritional support, it depends on sometimes what we eat. I'm very sensitive to sugars and to gluten. It's not that I have an allergy to them. They just don't agree with me really well. And I get joint pain, and I get stiffness, and I get these weird kind of like tingling sensations. So diet can actually affect all of this as well. And I don't know if that helps you, Jack, but it sounds like something that is more in depth and we can really talk about on the phone. It's something I have to put my hands on,
Right.
But
okay.
Go ahead, I'm sorry.
I'm going to have my doctor do the X-ray thing, and then I feel sure from there I'm going to have to go see somebody and I don't mind. I've never done chiropractic, so I'm anxious to see after the X-rays if that really would do something for me.
Yeah, and we don't know. And think of it this way, Jack. I'm not your typical, like I said before, I'm the only certified chiropractic orthopedist in the area. So I look at things a whole lot differently. And we don't, the manipulative therapy that we do is not as aggressive as some people would think it would be. And we can sometimes use instruments to adjust. There's different ways to facilitate to getting the corrections that we need to get in that patient. So we're not just racking and stacking and, somebody doing something that would hurt you more so than help you.
Okay. All right.
So,
well,
and listen,
you.
And you can, if you want to, my number is 855-7376. If you want to and say, hey, listen, I need to just talk to him after I get these x-rays, you call the office, you talk to one of the ladies there, say you've heard me on the radio and say, he said to call if I needed to talk to him. I'm not going to be pulled out of a room. I will tell you that. I'll call you later on and we can discuss it some more if you want to.
Okay.
I appreciate it, my
you.
friend. Good luck with it.
All right. Thanks.
He said something pretty interesting. We were talking about x-rays before he comes into the office, or, I hear that a lot. I can order x-rays. For Medicare, I can't. Is that the most ridiculous thing you've ever heard?
It's pretty ridiculous.
Not only can I not order x-rays, but I can't order certain testing because it's Medicare. I'm not doing it in my office. I'm sending you out to do it. But for some reason, we just can't. Medicare is such a pain in my, my derriere. Yeah, I'm telling you. You got to be, but I can't, I don't want to stop. I will tell you this. This is kind of funny. I got a letter in the mail recently, as a matter of fact. And it states that I see more Medicare patients than other professionals in my field in this area. I'm like, of course I do, because I'm the one that sees them. The other people aren't taking their insurance.
Yeah.
They don't want to see them. I'm like, so now they're saying this is not an audit. Yeah, they're going to come down and audit me anyway. Come and go like, why are you seeing these people? Why are you seeing them, so many people? Well, this is why. And, the funny part about it is the older we are, the more treatment that we need. Now, like physical therapy, chiropractic, OT, all of the therapies, it's called therapy, so it takes time to get there. Does that mean that every patient is going to see me 1,000 times? No. And one of the things we don't do, Joe, you come into the office, I don't have you sign contracts, I don't say you need to see me 5,000 times, it's going to cost you $8 million. We don't do that. I can't sell a Yugo. You know what I'm saying? I could sell a Porsche,
right?
But I can't sell a Yugo. We don't sell things that aren't going to benefit patients, and I don't sell anything anyway. So, when people ask me, hey, what bed do you recommend? I don't have a bed in the back. I'm not, I don't have beds. Now, I put stuff on my websites that I use, and I say, hey, listen, this is going to help you. Go on Amazon and go pick that up. Rather than them searching for it.
Right.
But other than that, the only thing that we will be doing is when we start doing some nutritional counseling, we are going to give you a list of all the vitamins and minerals that you need to take to help facilitate, getting better. Do you want to get them at my office? We can order them for you. You want to go over to Nutrition World again? Wherever you want to get them, go get them. That's not what we're trying to do. We're trying to, get people to get this. And we'll talk more about that as we come back. We're going to take a quick break. You're listening to Talk Radio 102.3. I'm Dr. Nick Circolone. Give us a call here at 267-1023, and we'll be back. We're back. Talk Radio 102.3. I'm Dr. Nick Circolone. You're listening to Health Chat. I just want to sit here and just kind of get into the music. I just like it.
Yeah, I've never heard of this band. Really good. Good stuff.
I'm looking for. I like new, different things.
I do too.
I have this eclectic kind of taste in music. My wife goes, "That stinks." if it's not the Bee Gees going, "Ha ha ha, say love," that's I can't help it. I married a woman that doesn't like the stuff that I like.
I get the same treatment.
Let me tell you, I've been married now. Last week was 23 years.
Well, congrats.
23 years, and I'll tell you, it has been amazing that she put up with me. It's been a lot of it's been interesting, but I will tell you this, and we're going to be talking about some marriage and family stuff as well. Actually, my daughter does. She's a marriage and family therapist, and I want to get her on with me, and we want to talk about some of that stuff and what they go through. Now, she's got pregnancy brain. It's kind of crazy. After my grandson's 3.5 months old, and let me tell you something. We're trying to get formula for him. It's ridiculous.
Oh, I've heard the news. But I'm not in that market anymore, but
it's ridiculous. Okay, because he was allergic to the Similac. I mean, we basically went down and made Similac for it. No, just kidding. We got Similac and he didn't like it. Well, he liked it, but it wasn't good for his little belly. So they got him a new stuff. So we're trying to find some formula for him. It's crazy.
And when you have that situation too, it just doubles the anxiety and just the trouble in trying to find it.
It's crazy. I mean, he's a hoss too. I mean, boy's a big boy.
Were you a football player?
Yeah, I don't know. Both my grandsons are big. My one was 9'6", and he was 8'6". So it was crazy. Joe, the time has gone. You know what I used to tell Julie? We could do 3 hours, man. I could literally do 3 hours. I love this so much. I feel like I'm home, man.
This could be your radio station. You could be on all day if you had the chance.
I would listen if you see Rush Limbaugh did it, and what was those other guys did it. I could do 3 hours. We can hang out. Well, guys, I hope you enjoyed our show. I hope you enjoy it. Please, kind of tune in. Look at us on Facebook. Type in Dr. Circolone. And you'll get us on Facebook. You'll get us on Instagram. And we're always looking and we're always asking questions. And when I was talking to Jack, I said to him, Jack, call me if you have any questions. You can do that anytime. That's an open invitation to patients. Call the office. If you want to talk to me and have a question, the girls can answer a lot of things. But if you have a question and you want to talk to me directly, then you can just do that, and I'll call you back. We're actually not going to be here the next 2 weeks. They're going to be pre-recorded. They're going to be a lot of fun anyway. I might throw in some old Julie stuff because she was so much fun to work with. I might do that. And, guys, it's been a great day.
Good to see you again,
It's
brother.
so good seeing you, man. It's like you're going to be with me a lot, aren't you?
Yes, sir.
Oh, I'm loving it. Well, guys, God bless. Have a great week, and we'll talk to you soon.